Hey YouTubers, so today is Medical Thursday right now, so yes, Medical Thursday right now, like the big ass cigar, so also not a doctor for the last damn time, so I am not a doctor for the last damn time, nor am I a patient or survivor myself for the last damn time, so anyways, my usual disclaimer, so anyway, talking right now, essentially tobacco, cigarettes, cigars, and pipes, and chewing tobacco, and dipping tobacco, and snus, and snuff, and vaping, and hookah, and essentially type 2 diabetes and quitting tobacco, so how they relate. So you have type 2 diabetes. This is the diabetes that is most commonly caused. This is the most common type of diabetes. You think about when you think about diabetes, frickin' diabetes. You think of type 2 diabetes, which is a type you get from being overweight, having too much sugar in your diet, having too much salt in your diet, being morbidly obese, having a poor diet in general, a crappy diet in general. That's the type of diabetes you think about. So in terms of how it relates to tobacco, cigarettes, cigars, and pipes, and chewing tobacco and dipping tobacco, it's a very dangerous combination. Actually, diabetes in general, fucking diabetes in general, is a very bad combination with tobacco. Any type of diabetes, whether it's type 1 or type 2, is a very bad combination for tobacco because essentially diabetes naturally puts you at higher risk for heart disease. So does tobacco, so does any form of tobacco because the nicotine, the frickin' nicotine puts you at higher risk for heart disease. And when you combine them together, it's just like being morbidly obese and also using tobacco products, it puts you at even higher risk for developing, heart disease in general. So if you're morbidly obese, you have type 2 diabetes, and you're a smoker, you're at exponentially higher risk, for developing heart disease. Also, it puts you at higher risk for certain things like vascular disease, like amputation of limbs, amputation of fingers, putting you at higher risk for strokes, heart attacks, kidney disease, etc., kidney failure, etc. So my message is, first off, if you are not a smoker, please don't start. You don't have the addiction yet, please don't start. Whether it's cigars, pipes, chewing tobacco, if you don't have the addiction yet, please don't start. If you are a smoker, it's always your best interest to stop using the product. I can't force you. That's my usual disclaimers. I can't force you. It's really up to you in the end. You have free will as an adult. However, I will say this. If you have type 2 diabetes, it is strongly recommended you don't combine it with tobacco or even alcohol for that matter. I mean, moderate alcohol intake is probably okay. I'm not a freaking doctor, but really any form of tobacco, freaking tobacco with type 2 diabetes is a very bad combination. So if you do have type 2 diabetes and you are a smoker, it's always in your best interest to stop using the product. And there are ways to help you. There's the patch, the gum, the inhaler, the lozenges, the quit smoking aids, medication, etc. So don't give up hope. You can successfully quit smoking if you have type 2 diabetes. And really the benefits of quitting smoking with type 2 diabetes is a hell of a lot better than developing complications, because you really don't want, honestly, do you really want to lose like fingers? Do you really want to lose a limb? Do you really want to lose, like, for example, your vision loss and everything is like your vision, your freaking vision, it could affect your vision. You could go blind in one eye. Do you really want that shit? It's like, no way in hell. It's like, I'm biased myself because I'm a smoker myself, but I don't have diabetes. I don't even have pre-diabetes. Pre-diabetes is when you have an A1C between 5.7 and 6.4. So I'm biased myself because my A1C was 5.2 the last time it was checked. So I'm nowhere close to developing diabetes. So I'm really biased myself. But the whole freaking point is, if you have full-blown diabetes, full-blown type 1 or type 2 diabetes, it's out of control, and you're smoking heavily, it's really time to think about stopping smoking. So anyway, have a nice day. Pretty fucking cool. Bye.